Guys, in this video we are going to cover the very first section of chapter 25, which is going to cover circulatory and lymphatic system parts. It starts off with yellow fever. We're going to get to that in the viral section later on in this chapter. Let's go through parts real fast about circulatory and anatomy. Before we do parts, we always got our case study. So with our case study, we have Barbara, and she is 43, so she's almost my age. She has had metastatic inflammatory breast cancer. And she is currently still going through chemotherapy. So she's got a port to get her chemo and attached to the catheter. And she started getting restless at her last doctor's visit, that her catheter has become uncomfortable. And they pulled off the dressing, looked at the port site, and it is red and warm to the touch. So she's got an infection going on in her port, which is super common, by the way. Barbara's also running a fever of 100 degrees. So they're going to treat the area with topical antiseptic, fresh dressing, and given the course of antibiotics. So we are going to check back in and see how that treats Barbara's infection at her chemo port. Major components of the circulatory system are going to be three big things. If you have not had AP2, our three big things are the heart and the vasculature. The arteries go in away from the heart, the veins come in back to the heart, the capillaries are the teeny tiny little things where gas exchange is going to happen, and then there is the actual blood pumping through. The blood is going to have three solid elements, the formed elements. We got white blood cells, we got red blood cells, and we have platelets, the little chunks of megakaryocytes that break off that help with clotting, the thrombocytes. So those are our major components: blood running through all of the vasculature, and then the heart that pumps it all together. Those are major components of it. We are going to need to know too, parts of the heart, because we talk about carditis, infection of the heart, inflammation of the heart, and where is that coming from? Specifically, endo is going to be on the inside. Endocardium is the inner layer, so the epithelial cells that line the inside of the heart and line the inside of the blood vessels is endocardium. That's the inside. Then we got myocardium. Myo means muscle, so that's going to be the muscle that actually pumps the heart. The cardiac muscle tissue is the myocardium, and pericardium is going to be on the outside. And the heart is just like the lungs; it is surrounded by a bag that is going to be protecting the heart. So every time the heart beats, it's not rubbing up against something and damaging itself. So it's got the pericardial sac around it. So if you hear later on when we talk about infections, itis, endocarditis, infection of the inside, myocarditis, pericarditis, those kind of things, it's just the location of the tissue on the heart that's getting infected. Blood flow through the heart is here in this picture. I don't think we really need to know that for this chapter, but you would for anatomy and physiology for sure. Arteries away from the heart, they're not always red. If we're talking about pulmonary circuit or the umbilical circuit, they are backwards. Systemic circuit going to the rest of the body though, arteries are red. They're going to be oxygenated arteries, but they always go away from the heart. Veins are always coming back to the heart. They're not always blue. Systemic circuit, they will be blue. Respiratory circuit, again, is backwards. Umbilical circuit to go into baby and back is backwards as far as coloration. But flow away from the heart is always an artery. Going back to the heart is always a vein. And in between are the teeny tiny capillaries. Major components of the lymphatic system. We are going to have the lymph vessels and the lymph nodes. So lymph vessels are pretty much, they buddy up with everywhere where there's a blood vessel and capillaries. We're going to have lymphatic vessels too. There are exceptions like the eyes and some other places in your body. There are exceptions to that rule, but for the most part, in general, you're going to have lymphatic system everywhere the circulatory system is, because when the circulatory system is flowing, right, we're under pressure. And part of that pressure is hydrostatic pressure that pushes fluid out of the vasculature and into the interstitial space in between the cells. And so we need to do something with that fluid, otherwise it accumulates as edema. So how do we get rid of that fluid? The lymphatic system. That's its job. And we're going to clean up that fluid and make sure that it's nice and pure before we dump it back into the bloodstream in our subclavian veins. So that's the job of the lymphatic system. Its major job is to take care of that fluid, make sure that we are not going to dump anything that is infected back into the bloodstream. We want to filter it and get rid of the fluid. So how do we filter it? Lymph nodes. Lymph nodes are where it's at. So as the flow comes into these lymphatic tissues, we're going to have capillaries, and then they're going to go bigger and bigger and bigger and bigger as we go. And they're going to have little valves that make sure that the fluid is going in one direction so it doesn't back out. Lymphatic system is going to flow this fluid. We're going to push this fluid. We don't have a pump like the heart, but we do have these one-way valves. And so that's going to make the fluid go towards these lymph nodes, and then the lymph nodes are going to filter it. It's going to come in one side, afferent. It's going to go out the other side, efferent. And as it goes out the other side, it is like 99 point blah, 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 blah percent pure. The lymph node has caught, hopefully, and captured, and the phagocytes that are living in there, the T cells and the B cells that are living in those lymph nodes have taken care of the situation. When somebody has cancer, like our Barbara has breast cancer and it has metastasized, that means it's going outside of the original tumor and it's going to different places. So is it going to the lymph nodes around there? And have they caught the cancerous spread? Has it moved to other organs? Those are stages of cancer. So one of the first stages is the lymph node catches those cancer cells, and they keep it inside there. So one of the things that you do when you remove the tumor, you start checking the lymph nodes next to the tumor to see if it had spread to those guys, because that's their job, is to clean the stuff up and make sure it's good before we dump it back in the bloodstream. So lymph nodes' job is to clean things up. Other things that are helpful with lymphatic system are also going to be the spleen, which is not over here, but we have it in a picture. We do. So here's our spleen, and this guy is going to help filter the blood. It's going to help with our immune cells, our B cells, and our T cells. It's going to have phagocytes in there that are going to be eating up things. So the spleen is really important. Sometimes if you have a viral infection, it can get enlarged, like mono that we're going to talk about in a little bit. Epstein-Barr does that. But here is the spleen. Over here, it's going to help. Here is an enlarged picture of our lymph node. And again, I said it comes in and then it's going to leave out. And by the time it gets out of there, it's 99 point something percent pure as it leaves. So those are major parts of the circulatory system and the lymphatic system that buddies up with this circulatory system to take away the fluid that can accumulate. All of the different terms that we need to know. Bacteremia, we've went through some of these, so you already know some of these. Bacteremia, bacteria in the blood. Is that bacteria reproducing and actively growing in the blood? Then it's septicemia. So we've done bacteremia, septicemia. What about if there's viruses in the blood? Viremia. What if those bacteria made toxins like E. coli we talked about? It's hemorrhagic toxin that it makes. That would be toxemia, or any of these other guys that we have talked about. There's so many toxins coming from different things like salmonella and campylobacter. And if you got toxins in the blood, toxemia. What about SIRS, which is systemic inflammation response syndrome? And that's where you've got the infection, the microbes are in there, and they trigger an inflammation response, and that is going to damage the tissues and the organs, and that leads to sepsis, where everything kind of freaks out and gets inflamed, and it can lead to sepsis, which we know leads to shock and organ failure and death. So very serious condition going on with SIRS. Sepsis, just talked about that. Inflammation, vasodilation, that fluid is going to leave our capillaries and it's going to go into the interstitial space. So we're going to have a drop in blood pressure. We're going to have edema swelling up all over the place. The drop in blood pressure, that means that we're not filtering the blood, and we are going to not have the proper pressure to filter the blood in the kidneys. The heart's going to suffer, the lungs are going to suffer, kidneys are going to not be functioning like they should be, and it leads to multi-organ failure. So super serious, big deal with sepsis. Endo, myo, and peri, the different parts of the heart that can get infected. What if we're not talking about the heart? What if we're talking about the vasculature in some place? Like maybe the capillaries have gotten something going on with them. Or maybe we're talking about this one vessel area through here. If we're talking about the vasculature, capillaries, arteries, veins, vasculitis. Um, what about petechia? We are going to see a picture of this in the Rocky Mountain spotted fever. The spotted fever is petechia. You will also see this with meningitis, can also cause petechia. My brother-in-law, when he got septic after his surgery, he was getting petechia, and it is ruptured blood vessels. It looks like a rash, but it's not a rash, is what petechia is. Ischemia is when those blood vessels are rupturing and you're not getting, if the blood vessels are ruptured, they're blocked, but somehow the blood flow is not going to the tissues. If the blood flow is not going to the tissues, then they are going to suffer. They are going to die, and those tissues will then become necrotic. So that's ischemia. Um, Lymphatic system issues. Lymphangitis, and that's going to be inflammation of the vessels, and you will see them as red streaks. Somebody's getting septic. We can maybe see this going on. And then lymphadenitis, we call them buboes. I call them buboes. Anyway, the anatomy and physiology textbook calls them buboes. So that's what I'm going with. When you are palpating for enlarged lymph nodes, like when you're sick, those are buboes. Okay, so that covered the first part. Bacterial infections is a really long section, so I'm going to make that in a separate video.